Welcome to this COVID-19 video series. My name is Leah Hampson-Yoke. I'm a physician assistant specializing in infectious disease at the University of Washington and Fred Hutch Cancer Center. In this series of videos, we'll be talking about COVID-19, detection, prevention, treatment, and shared decision-making that you can do with your patients. COVID-19 has changed a lot since the pandemic initially started back in 2020. And while it's responsible for less disease, there still are a number of patients that have severe illness and death in the United States from COVID-19 caused by the virus SARS-CoV-2. What we also know is that SARS-CoV-2 virus has a bi-seasonal variation, meaning that it often peaks both in the winter and in the summer. There are different variants of the virus that can also peak, and we have seen those over the course of time as we've learned more about the COVID-19 illness. COVID-19 is tracked in a variety of ways. Currently, there is less tracking that's occurring as this virus has become more endemic, but we do know about some of the seasonal variation through wastewater tracking. What this means is that COVID-19 is actually tested for in our wastewater, which gives us a population basis of understanding COVID-19 seasonality and also times when COVID-19 is surging. This gives us public health information about times when we ought to be perhaps performing more social distancing, masking, and also thinking about treatment in our population, which would inform testing. The CDC estimates between October of 2024 and July of 2025 that there's been roughly around 13 million cases of COVID-19 and roughly around 45,000 deaths. COVID-19 can really vary. There's patients that may present asymptomatically, and there's also patients that can present with severe disease. We'll talk more about what that means momentarily. COVID-19 can also look like other respiratory viruses. And when I think about COVID-19, I often am also thinking about RSV and influenza. And the reason I think about these in particular as sort of the big three is that these particular viruses have treatments that we can offer particular patients. We also know that COVID-19 has sort of two phases of infection. There's early infection or acute infection, and then also post-infection, which typically happens 4 weeks or so after the initial infection. We also need to understand some definitions about COVID-19 severity. So there can be mild illness or disease, which is defined as not having an oxygen requirement, but having symptoms and testing positive. But we also know that there's severe COVID, and that would be defined as patients that do have an oxygen requirement or need additional ventilator support. When we think about COVID-19 infections in terms of time, patients often have an initial spike in their viral replication and might have initial symptoms. As viral replication decreases, because of immune response, there might be pulmonary response or pulmonary symptoms, including the need for supplemental oxygen. However, patients who become critically ill often have lower viral loads, but have something called a hyperinflammatory state, or also we call it sometimes cytokine release, where the immune system is reacting so strongly to the COVID virus that they often have critical illness, acute respiratory distress, and even death. We'll talk about this more in future videos, but post-COVID is a condition I'd like to bring up now, where chronic conditions can exist after COVID infection or even after viral clearance. We know that this is a complex topic. It's multifaceted. Patients can present with a variety of symptoms, including rheumatologic symptoms, chronic fatigue, muscle aches and pains, and it can affect 1.6% of adults after COVID infection. We also know that risks of post-COVID can be reduced by things like vaccination, by things like treatment of COVID. And we also know that there's many multidisciplinary clinics that help address the very multifaceted symptoms that come along with post-COVID. There's also higher risks, including age greater than 50, as well as socioeconomic disparities that may lead to differences in post-COVID conditions in different patients. In 2022, 6.9% of adults and about 1% of children presented with post-COVID. In this video series, we'll be talking about testing, treatment, and shared decision-making around COVID-19, so that you as a PA, when talking with your patients, can help them understand their risk, make good choices, and also public health awareness.